Hello and welcome to episode 15 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is load management, how to get back to weightlifting in the gym, back to other activities and other exercises that you enjoy following low back injuries, whether it's a general low back injury or a disc herniation or sciatica or anything related to the low back at all. We are going to be discussing how you can get back into those things without overdoing it, flaring things up, making it worse, and ensuring consistent weekly progress towards that. So I want to start off with a personal story. This is actually something that just happened a few days ago. I posted it to my story. For those of you who follow me at RehabFix on Instagram, I advise that you do. If you do not, I post a lot of content there, videos every day, and then I post a lot of content to my stories as well. Anyway, as many of you may or may not know, I just came off a bodybuilding preparation and competition. This is a 4-month process that I went through to get my body prepared, and my regimen was very strict. So something that I enjoy doing from time to time is riding my bike. And I have a typical road bike, which we all know is much more of a hunched over position, right? And that's not something I was doing during my bodybuilding preparation. And it's actually something I wasn't really doing for a few months before it as well. But before that, it was something that I enjoyed doing. I was probably doing it a couple times a week. But up until this point, up until a few days ago, I had not ridden my bike aggressively in any way for probably 6 to 8 months, okay? Now, I don't have low back issues. I don't have, I might have a disc herniation on an MRI, but you all know that that's not something we should be concerned about. So I might have something on the imaging, but I don't have a symptomatic disc. I don't have low back issues. I don't have low back pain. I don't have low back problems. However, I went on a relatively aggressive 1-hour ride the other day. I rode 16 miles. I have not ridden my bike for 6 to 8 months. For the last 15 minutes of the ride, my low back was getting pumped up. It was getting tight. It was getting stiff, aggravated, all these things. And I was leaning up on my bike, trying to sit up straight and stretch it out. And that evening, I noticed my low back kind of tight. Next day, woke up, it was sore. My low back was sore. Now, do I have low back problems? No. So I didn't let it worry me, and I don't think it should worry you guys either unless you are suffering from low back issues, and that might be a trigger. But I wasn't worried because of the concept that I'm going to explain. That was something that my body was not used to. Is it something my body used to be used to? That was kind of confusing phrasing there. But yes, it used to be used to that. Kind of silly. I'm sure I could phrase that better. But it wasn't at this time. So just like if you went into the gym and you worked out a muscle group very hard that you have not worked out or trained before, you're going to get some feedback from that. Okay? It's going to let you know, hey, we are not used to this. We have not done this before, or at least in a long time, and you might feel some aches and pains that aren't normal with a regular workout that you might otherwise be adapted to. That's load management. Too much, too quick, tissues aren't used to it. You get a little bit of feedback that might not be the most desired. That's exactly what happened to me. Got on my bike, pushed it, low back felt achy. I don't have low back problems, but I did something that my low back wasn't used to. So for many of you, including those who I coach, if you're one of my online clients listening to this, which you should be, this may be one of you, and we have to work through these scenarios sometimes because this is a very, very important principle. With load management is all about slowly increasing load and managing the rate at which we do so. So let's say you're an individual out there who's dealing with low back issues and you want to get back to squatting or deadlifting. Let's say deadlifting. Let's make this easy, okay? Deadlifting. Let's say we're halfway through the program working together. Most of my clients halfway through are pain-free, symptom-free, and ready to get back to the gym and to the exercises they want to do. That's kind of the way that this is designed. If you're a good candidate, you should be mostly pain-free by the halfway mark and ready to get back into regular activities. That does not mean they're done. This is where load management comes into play. Just because your pain is gone does not mean the issue is 100% resolved. A phrase I like to live by is when the pain is gone, that's when the real rehab begins. So let's take one of my clients, for example. They're halfway through the program. Their sciatica is gone. They have full range of motion in the low back. They don't feel restricted. They're feeling amazing. And they used to be able to deadlift, let's say 300 pounds on a weekly basis. And they haven't deadlifted in a couple years, let's say. Hey, Grant, I'm feeling so good. I'm going to go get back into deadlifts. Awesome. Yes, let's do it. I'm so excited. I encourage that, and I help them through that process. But should they jump right back into trying to do their old numbers? No. And some of you may be like, well, yeah, duh, but let me make it a little bit more specific for you, a little bit more structured so you can apply it to your own life. The rule of thumb is we do not want to exceed 20% increase in load per week with any given activity or exercise. So if they are not used to deadlifting, if they have not deadlifted for 2 years and they're just now pain-free, that does not mean I'm going to tell them, hey, you're feeling great. All right, go ahead and try to pull 225. No. We might start with just the bar, 45 pounds. Get that hinging motion in. Maybe do a couple sets. That's it. Assess the way they feel during, assess the way they feel after, assess the way they feel the next day. If their body handled that okay, all right, let's do that a second time this week. Okay, cool. So week 1, just the bar, 2 separate times. Okay, well, that's obviously pretty light. So we don't need to slowly increase 20% starting at 45 pounds. So maybe I'll tell them if they're a relatively fit male, okay, I'll say, hey, let's go up to 95 pounds now. Okay. All right, so we do 95 pounds. Assess the way they feel during, that evening, and the next day. Can their low back tolerate it? Can it adapt? We have to give it time to adapt. Yep, they feel okay. All right, maybe we do it one other time that week. Okay. So now I'm going to start to get specific here. Okay, so let's say we do 135 now. We're going to 135. So these are somewhat fast jumps, but keep in mind, this is someone who, let's say they're a 200-pound male and they're strong. They're just generally a strong person. They're generally a bigger person, okay? Those initial jumps aren't necessarily a big deal, but here's where it can become a big deal. Now that we're at 135, okay, we need to start making slow incremental jumps. Slow jumps, all right? So we're not going to go from 135 to 185 to 225 to 275. We're not going to do that. We're going to slowly increase by no more than 20% per week. So I'm not going to do a whole bunch of mental math right now, but maybe what that looks like is 135 to 150 to 170 to 190, okay? Those are small incremental jumps. And we're going to slowly do that week by week, ensuring that they feel okay during that evening and the next day, giving their body time to adapt to that load. We are managing their load. That is crucial to going from the rehab phase to the performance phase. It is absolutely crucial. And if that is skipped, that is when flare-ups occur, that's when regressions occur, and that's when people get very, very frustrated because hey, I was feeling so good, and then I went in the gym, I tried to do my normal exercises, and I'm in pain again. What the heck? The rehab didn't work, or this didn't work, or that didn't work, or my back's no better. Well, no, that's not the situation. You are better. The rehab did work because you're pain-free halfway through the program, right? It's the fact that you didn't manage the load, and your body was not adapted to the loads that you were trying to place on it. So coaching through these steps is crucial to getting you back to, once again, not only specific exercises in the gym, but exercises as a whole, activity as a whole. So you could apply the same thing to hiking, to riding your bike, to tennis, to basketball, and then of course to deadlifting and squatting because those are low back demanding. So this is the main concept. You do not want to exceed 20% per week in load. So once again, to make this simple, let's say you're starting at 100 pounds on any given lift. That means the next week you would not want to go above 120, assuming your sets and your reps are the same. Now, if you're changing your intensity, if you're changing your frequency, if you're changing your reps and your sets, obviously you need to take those things into account. But I'm trying to make this as simple as possible so that you can apply it to your life. And expert runners, I've worked with elite runners, they will even say they only do 10% per week increase in running. Otherwise, you're going to get injured. So no more than 20% increase in load is what we want to pursue as we're going through the phase of getting you back to the exercises that you want to be able to do again. This ensures that your rehab is completed the right way and that you're not only pain-free by the end of the program, but you are able to do whatever you want to do with confidence, and you don't have to worry about your low back. You don't have to worry about going to the gym and flaring something up, or, oh my gosh, I feel that again squatting. Oh no. It ensures that you get past all of that so that you're bulletproof by the end of your rehab program. That's where you want to be. So wherever you're at, when the pain is gone, that's when the real rehab begins. Do not just run back to all activities as soon as the pain is gone. I have had clients, and some of them might be listening, where the second they feel good, they go jump into a CrossFit class or a boxing class, or they try to go max out again in the gym. And almost every single time they flare up. Grant, hey, I did this. I thought I could do it, and blah, blah, blah. And yep, we're not ready for it. And so we have to go through a brief period to get them back on track, and then we're good. And we learn this lesson, but we learn it the hard way. And I don't want you to learn it the hard way. I want you to learn it now so that you don't find yourself in that position. So this is how you go from rehab to performance. This is how you get back to doing the things that you want to do in an appropriate way. Make sure you manage your load. And if you apply these principles to your life, to your low back program, to your low back recovery, or any other injury recovery, then you will be successful. And if you're confused on how exactly to implement it, what other variables need controlled, what exercises you should be doing for your low back, should not be doing, and there's still some confusion about the plan that you should be following outside of managing these loads, because let's be real, you need to manage your load when you're getting back to these things, but you need a plan to be able to get you pain-free first. You got to be able to get pain-free. You got to be able to restore function, restore range of motion, and then you can enter that phase. So if you're not even to that point yet and you're struggling to find help, well, let me know, or, find another provider in your area that is skilled in these particular topics. But I have online clients all over the world, and I would be honored to help you as well get to that point and then go through this load management period to get back to exercising, doing the things that you want to do. Finally, just want to thank you for listening. Once again, please rate, review the podcast. It helps it get boosted and exposed to more individuals so that more people can learn ways that they can recover from low back issues. If you're watching on YouTube, please like, subscribe, and leave a comment below for the algorithm. And let me know other topics that you would like me to cover. Otherwise, let's keep working hard, let's keep pursuing our goals, and let's keep learning how to fix our low back. Thank you for watching.